Okay, let's take a look at going on type 2 diabetes pills versus using activity, healthy diet, and intermittent fasting when you're been diagnosed with type 2 diabetes. Okay, first thing is any type of fasting, especially if you're going to do a strict fasting where you're not eating any food, say 5 to 7 days, you always want to do it under medical supervision. I'm going to say that every time. So make sure your family doctor knows, and he's going to be testing your blood sugar from time to time to make sure that you're making progress. So you might ask, well, why would a family doctor, if you have millimoles per liter over 7, because healthy is 4 to 7, why would he give me pills if he knew there was something that could work that without pills? Well, here's the thing. Most people who are obese, and remember that's a BMI of over 30, or morbidly obese, it means you're really, really heavy. We're talking like 50, 100 or more pounds. And, you know, the doctor is probably thinking this person is entrenched in their ways when it comes to eating. They probably don't. They're probably not very active, and they've probably been eating sugary carbohydrates and too much food for a long time, and that's why he or she is going to give you pills. Their thinking is that even though it's according to Jason Fung, the fasting doctor in Toronto, most people go on who are diagnosed with type 2 diabetes and go on pills. Their blood sugar is artificially reduced, but they tend to gain weight, and now they're going to be on those pills the rest of their lives. And so basically, your doctor is telling you, I don't think you can change, and that's the time where you need to tell them, I can change. And one of the things about intermittent fasting is that you start to see results quite quickly. Okay, so if you do out of the gate, if you start with a eating window where you only have meals between noon and 6, you and you're having healthy meals, and you're doing some activity. Start slow. I my main activity is walking. You will start to see that you're losing weight, and when your blood sugar is tested, it will go down. So I understand why doctors give pills, because probably the majority of their type 2 diabetes patients have shown themselves to be incapable of change. And and that's fine, but you're not one of those patients. You're going to make changes, and you're going to just try to imagine yourself with a healthy BMI, which I think is around 25. And give yourself a lot of time to lose this weight. Losing 2 pounds of fat a week is really all you need to do. So there's 52 weeks in a year. That's 104 pounds. And generally, if you're obese, if you lose 10% of your body weight, so let's say you're 300 and you go down to 270, that's going to have a significant impact on your blood sugar. It might even bring it back into a normal range, although at 270, you're going to still want to be losing weight. So, if you find yourself with a type 2 diabetes diagnosis, um, it can be reversed according to Dr. Jason Fung, according to me too. I've done it before. 6 years ago, I did it, and I'm attempting to do it again. But also make sure that you understand that you're going to have to make changes, and they don't have to, be huge changes. Just eating better food, healthier food, eating it in a shorter amount of time per day. This whole the model we have present model we have of 3 meals and snacks is, really puts a tremendous amount of pressure on your body. It makes your body have to put insulin into your bloodstream over and over and over and over again, and that's how you end up becoming insulin resistant, which is essentially, the main cause of diabetes. Right, your body just doesn't respond to insulin anymore. Anyway, so just keep that in mind. That yeah, these pills work in quotation marks, in the sense that they artificially lower your blood sugar, but they don't. You know that I think when your blood sugar is artificially lowered, it doesn't mean you're healthy. And in fact, I suspect that the negative effects of diabetes will eventually be felt by you, even though your blood sugar has been, artificially lowered. So, if just talk to your doctor and tell them you want to try something different. Um, you know, drop the name Dr. Jason Fung. Maybe your doctor needs to hear about a alternative solution to type 2 diabetes rather than just taking a pill. Okay? Now, I'm not a doctor, I acknowledge that, but Dr. Jason Fung is. He's had tremendous success with, I don't even, an untold number of patients over the years, helping them not only go from obesity to a healthy weight, but also completely reversing their type 2 diabetes, where they just don't have it anymore. Okay, that's all I got for you today. We'll talk soon. Take care. Bye bye.